I think Alzheimer's is the worst thing on earth. I thank the Alzheimer's Association, the Connecticut chapter, for offering respite to caregivers and to patients. This is a terrible, terrible disease, the worst I think you can imagine, stealing oneself from themselves. That's why I and many, many thousands of others around the world will not stop until we can end this disease. And the Alzheimer's Association plays a huge role in this. So Alzheimer's disease, as you all know, is the most common form of dementia in the elderly. A confirmed diagnosis requires seeing the pathology in the brain, which I'll show you in a moment. And major risk factors, number one, age. This is an age-related disease. The prevalence increases dramatically with every decade after 60. It doubles in prevalence with every decade after 60. But what caught my eye really 25 years ago was the strong influence of family history and genetics. Inheritance of AD is involved in 80% of cases based on twin studies. I believe at the end of the day, we'll have hundreds of genes, maybe 100 to 200 genes that in some way influence your risk for Alzheimer's, either by conferring susceptibility, by causing the disease directly at some age, or protecting you. In our screens, we find just as many protective genes as we find risk-conferring genes. But this is a very common disease. I mean, 40% of people over 85 have Alzheimer's. We all start getting Alzheimer's pathology in our brain after 40 years old. Now, life exposure factors include head trauma, traumatic brain injury, stroke. Basically, any insult to the brain is a risk factor. Vascular risk factors like obesity, high cholesterol. It's probably, genetics has shown us what's good for the heart is good for the brain. Social isolation, loneliness, a major risk factor. And I have added insufficient federal funding. This is a major, major risk factor. So many of you know that there's when you compare funding for other diseases that deserve funding, like cancer and AIDS, Alzheimer's is the redheaded stepson, so to speak. We just don't get the respect we need from federal funding. Now, this is a very scary slide because it shows here the increasing cost and the increasing number of victims of Alzheimer's, a lot of this based on Alzheimer's Association demographics, from 2005 to 2030. And you can see there's this exponential rise in cost of the disease and victims. And on the right side of the slide is federal funding for Alzheimer's research from 2003 to 2007. So what's wrong with this picture? It's an issue, and it's going to get worse because for some reason the government's not stepping up and realizing that this is an epidemic that's going to crush us. This slide shows here that between 2015 and 2020, we're going to hit the tipping point. Somewhere between 2015 and 2020, if we're in the same stage we're at now for treating this disease, the number of victims will outpace Medicare and Medicaid costs so much that Alzheimer's alone will bankrupt Medicare and Medicaid. I mean, this should be enough to just tell the government, we have to stop this disease. And $400 or $500 million a year is not going to do it. So I think that in terms of the therapeutic goals, I state them this way. One, we need treatments that actually halt or reverse the disease progress in patients who already exist, who already have the disease. Second, going into the future, how do we end Alzheimer's disease? We prevent it from ever striking in the first place. The future is to know you're at risk, to have protection of your genetic destiny, and to start preventing this disease based on a personalized genetic medicine approach from day one.